How can I help you?
So I had fractured elbow
Yes?
and with plate. Can you do this with a plate?
Yes?
Okay.
Maximum
So it's
will
very
fly out.
sensitive. To lean on, it's sensitive.
Ladder. So this is the chain without the implications, all right? I need a triple cord. I need a Pachi. I need this and this. Now, I'm walking into the treatment room and the patient already knows. So this is the scar, right?
That's the scar.
Now, when I do this, is that too sensitive?
Just right there, right
Here,
here.
here. And do you feel here numbness?
That feels normal.
Normal. And here numbness?
A little bit of numbness.
So this is a classic for rings. Do you remember when I said on
Yeah.
one area of the scar, numb, one area of the
Yeah.
scar, painful? So the painful, the hypersensitive will have the green, and the numb will have the red, and they will look at each other. I put the triple cord, put the aluminum foil, spark it, and I will treat it like this. But she wants to see how we do, that's why I asked, how we do the chain. So, let's see if we have enough chain. If we have enough chain that covers the numb and the... If this is the painful and this is the numb, right? And this is normal.
Right.
That's normal. The condyle is normal.
Correct.
Okay. So that looks like we have enough. Just about enough, right? So okay, green on the most painful,
Now, are these color coded? No, these are blue.
blue, and the red is where the more numb is. And if we want, the clips to be fixed right into place without moving because of the very specific area that we're working on, yes, then we can tape them right into place also. And I'm using the aluminum tape because the whole idea is to now wrap it with an aluminum foil, and the thinner foil is the better foil, okay? There's something to say about the aesthetics of this treatment, too. Some will like it, and some do not. Important is that there will not be a bubble, that the aluminum foil will touch the skin, will touch the chain. Okay? Kawai says that it is important that all the elements will actually really touch the skin. If you feel it, you tell me. Most people don't feel it. What I want to do is I want to have the spark, yes, I want to have the spark touch the aluminum foil. Now some people are really, really sensitive. So, sometimes you just hold like this. Because you don't know the reaction. If a patient has not felt an electric stimulus before, you never know how they react. Some people give up a really loud scream and very strong reaction. They're terrified from it and they didn't know. Okay? So everything is possible. I'm saying that to you, most of the time patients don't feel it, but sometimes when patients feel it, you can have all kinds of response. I'm telling you to be alert. And then you just while this is going on, there is no contradiction to do ASIS. This is a nerve pain or nerve alteration kind of phenomena. A little bit numb here, a little bit pain here. Overall hypersensitive. That CV12, right? Definitely. If we look at this arm, we're looking at what? Small intestine, triple warmer, find the meridian and see fire points and see the reflections in the ear of that region. All of them, with this on or not, is part of the treatment. You understand? So there's tons of options. That's what I like also by these kind of alternative or additional treatment modes so let's say that the regular acupuncture, this is a real case that can come to you. So in acupuncture, so you do the spleen qi deficiency with the liver excess treatment a la TCM, and you look at, okay, so here is painful, you look at the scar. Some schools of acupuncture will just put the needles in the scar, and I can already tell you that most of the time people really don't like it and it doesn't work that great. Some people in some schools of acupuncture will do exactly the opposite side because of the mirroring in the brain. And actually that has a very good chance, especially with very strong pain, to change it, to reduce it. Some schools of acupuncture will say, okay, what meridian? And they will put it distal on the meridian. Some schools of acupuncture will use the ear as a reflex. Some schools of acupuncture will use, constitutional and then laser. And you know them all. Here specifically because of the one point is numb, one point is hypersensitive, I would actually use rings because they are really focusing on one point like this, one point like that. Do you understand why? Yeah, okay. If the chains and rings don't work, I immediately take it off and I then use the laser. You know what I mean? So I decide there's no criteria for me to decide in this particular case one or the other. I choose one or the other, depends on what mood I am that morning. Okay? However, what I don't change is the effect, meaning if it doesn't work, I will do something until it does. And then 3 times, they pinch you with the...
Yeah, I don't know what that was.
And now, within the parameters of how you felt prior, compare to how you feel now. But one moment, let me just take this whole configuration off. Sorry. Okay. Now you tell me, since you dealt with it.
It's just numb.
So the hypersensitive is no longer sensitive.
Yeah. It's different. It's totally different.
Okay, totally different. So again, now if it's totally numb, that's fine. I tell the patient, listen, we took away the hypersensitivity, that's very nice. Only numb I also don't like, but something has already changed. The hypersensitivity is gone. Work with it a little bit, might work. Or this would be a good idea now, when she, let's say, turns to the side and I do the back treatment, I can now use the CV12 because that really works on numb much, much better than hypersensitive. Right?